Professor Bauld, what's driving this new wave of infections then?
Well, we're still in the Omicron wave, but we've got these Omicron sublineages, BA4 and 5, and they have what's called a growth advantage, so they're spreading more quickly. And that is really the main thing behind this. And they're also able to reinfect people. So quite a few people have had COVID in the past, and they're picking it up again, and that's contributing to these numbers.
It's spreading quickly, but is it more lethal than the other variants?
We don't have any evidence to date yet that these sublineages of Omicron are causing more severe disease. We do have more people in hospital. We have about 1,300 people in hospital now with COVID. That's up from around 600 at the beginning of the month. But that's just adding to the numbers. It's not saying that people are becoming more unwell.
So it is still some way below the record high at the peak of Omicron. Do you think it could get worse?
Well, interestingly, if you look at the ONS infection survey, we've seen another rise this week, but it's not as big as the rise the week before. So I'm really hoping that things will actually level off. Of course, schools have now broken up across Scotland. Some people are not having all those indoor interactions. So if you look at Portugal, they've been ahead of us in this wave, and they're now seeing a decline. So I hope that will occur over the next few weeks.
But Scotland seems to be faring worse than the rest of the UK. Why do you think that might be?
It's difficult. You know, we've waxed and waned through the pandemic. These comparisons are tricky. I think we were at quite a high level earlier in the spring, just before the summer. And now these Omicron variants, of course, have added to that wave. So I think it's more that we started from a high base rather than that things have deteriorated here more quickly.
So do you think it might be time to put measures back in place, like wearing masks in crowded areas? Would that help?
Well, I would always say, you know, look at what's happening. Are there high levels of infection in the community? There are at the moment. So the practical things that we can do that are not restrictions, they're basic protections. Wearing a face covering in busy and closed public places. Think about hand and respiratory hygiene. Recognizing some people are more vulnerable and thinking about them. These are not big things for us to do, and we can all do them.
Thank you very much for joining us on the STV News at 6, Professor Linda Bauld.